Few medical treatments evoke as much fear or misunderstanding as electroconvulsive therapy, better known as ECT. Popular culture has branded it as barbaric, a symbol of psychiatry's darkest hour. Yet, despite its brutal past, ECT not only survived, but remains one of the most effective treatments for severe depression today. To understand how shock therapy evolved from horror to healing, we must travel back to an era when electricity itself was seen as both miraculous and monstrous. The story begins in the 1930s, when mental illness was poorly understood and treatments were often experimental. Psychiatrists had few effective options for conditions like schizophrenia, catatonia, or severe depression. Early biological therapies were desperate attempts to shock the brain or body into normalcy, literally. Experimented with inducing insulin comas or malaria fevers, hoping that jarring the nervous system might reset it. In 1938, two Italian psychiatrists, Ugo Cerletti and Lucio Bini, had a radical idea. What if electricity could produce a similar effect without killing the patient? Their inspiration came disturbingly from slaughterhouses. Cerletti had witnessed pigs being stunned with electric shocks before slaughter. The animals briefly convulsed, lost consciousness, then revived moments later. He wondered, could the same principle be applied to humans to interrupt mental illness instead of ending life? The first human trial was grim. A man with schizophrenia was restrained, electrodes placed on his temples, and a jolt of electricity sent through his skull. Convulsed violently, fell silent, then awoke calmer than before. The results seemed miraculous and horrifying. Soon, ECT spread rapidly through hospitals worldwide. In an age without modern anesthesia or muscle relaxants, early ECT treatments caused intense full-body seizures. Patients often broke bones or teeth during convulsions, and memory loss was common. By the 1940s and 1950s, ECT became both a symbol of psychiatric progress and its greatest shame. While some patients did recover, many others suffered lasting trauma. The treatments used on unwilling patients, especially women and institutionalized individuals, turned it into a weapon of control. Movies like One Flew Over the Cuckoo's Nest later seared its brutal image into public consciousness. Yet beneath the fear lay undeniable evidence. ECT worked. Even as psychiatry advanced with antidepressants and psychotherapy, shock therapy consistently showed extraordinary results for patients with treatment-resistant depression, those who found no relief elsewhere. Modern studies report success rates of 70 to 90%, far higher than most drug therapies. The challenge was to make it safe, humane, and ethical. In the second half of the 20th century, ECT underwent a quiet but radical transformation. Patients were now given general anesthesia and muscle relaxants, eliminating convulsions and physical trauma. Electrical currents were precisely measured to minimize cognitive side effects. Instead of indiscriminate shocks, doctors targeted specific brain regions with controlled pulses lasting milliseconds. The goal was no longer to erase madness, but to restore balance in the brain's neurochemistry, especially in mood regulation circuits. Modern ECT typically involves a brief, medically induced seizure lasting under a minute. The patient sleeps through the entire process, monitored by anesthesiologists and psychiatrists. Most wake up groggy but stable, often showing improvement after only a few sessions. The exact mechanism remains a mystery, but researchers believe ECT resets neural pathways and increases the availability of key neurotransmitters like serotonin and dopamine. Despite its proven effectiveness, ECT's reputation remains haunted by its past. Many still associate it with punishment or control rather than treatment. Ethical guidelines now require informed consent, strict oversight, and post-treatment care. In most countries, ECT is reserved for patients with life-threatening depression, catatonia, or severe bipolar disorder conditions where other treatments have failed or where immediate relief is needed to prevent suicide. Modern psychiatry continues to refine the therapy. Variants like transcranial magnetic stimulation, TMS, and deep brain stimulation, DBs, offer less invasive alternatives. But none have matched ECT's reliability for the most severe cases. To this day, it remains both the most feared and the most effective weapon against intractable depression. The irony is profound. What began as a crude and painful experiment now saves lives quietly, every day, in hospitals around the world. The same electricity once used to terrify has become a tool of compassion. ECT stands as a reminder that medicine evolves not just through discovery, but through humility. Its survival is proof that even the most frightening treatments can be transformed when guided by ethics, empathy, and science.